Hey everyone, it's Brandon again. I wanted to talk to you about the future of ultrasound, specifically in the physical therapy practice. I think that we can all agree, again, it's currently March of 2020, so we're really in the kind of the midst of this coronavirus pandemic of COVID-19, and we're seeing a major shift in the not only the healthcare world, but the entire, global economy with how each business or businesses are going to be able to reach their customers and allow to thrive on given this and what the future is going to look like. So really, let's take a step back for a second and talk about how has physical therapy changed in the last, maybe the last 100 years. And really, where do I think the future is going to look? Not that I know what the future will be, but here's kind of my presumption. So previously, physical therapists were, only, received or utilized in a brick and mortar capacity. So I'm not going to talk about what we did back then or how it was done, because there were faults in medical advances and technological advances that have occurred, but it was almost always seen in that brick and mortar setting. And in the last, I'd say, 10 years or so, we're starting to see a strong shift going from a brick and mortar to a mobile or a concierge or just a patient centered style or lifestyle. And to be quite honest, um, it's not just with physical therapy. I've seen it with there's a dentist in the area that actually conformed an RV, and now he has a mobile, RV dental suite, and he just drives from patient home to patient homes and does their dental services right there. Very similar setup with a dog groomer, and I'm sure there's many other styles of that. So we're starting to see more of this mobile, we come to you setup, more of, well, how can we make it more convenient for the patient or just patient centered? And because of that, and because of what's currently going on with the coronavirus pandemic, and not that this is the first time it's been talked about, but physical therapists have been fighting for and advocating for the use of some sort of telemedicine or telehealth or telerehab services for quite some time. And it seems like maybe given this pandemic, the future may actually provide a scenario where we get to use this on beyond just a cash or an out of network basis, but get to utilize this, through our patients' third party payers or their private insurance. So, kind of taking this pendulum swinging from, seeing them directly in a brick and mortar or clinic location, and going all the way over to the opposite side of the spectrum, which would be, only on a mobile platform setting. I really think the ball is going to kind of fall somewhere in the middle of that, where the hybrid model, at least for the strong future, is going to kind of reside a little bit of both, or kind of the best of both worlds. And what I mean by that with that hybrid is there are many instances or scenarios in where a face-to-face visit is going to be much more warranted and much more advantageous to both the clinician and the consumer, in our case the patient, or in any patient regardless of what healthcare field they're in. And by doing that, and I think many clinicians can agree that a hands-on skilled assessment is going to be better than kind of sitting behind the camera and telling the clinician, raise your arm up or do this or do that, so I can kind of diagnose you from a without ever touching you. With that said, that hybrid model is going to have kind of an added advantage to being able to help your patients, or maybe you live in an area where your patients are traveling a lot, or you're able to help patients that are maybe snowbirds, like where I live in Southern California, where I have patients 6 months of the year, but then another 6 months of the year they leave. They want to stay with me, but they're not able to. So by utilizing things like this mobile or hybrid model, we're able to kind of give an opportunity to help those patients. And so where does ultrasound fit in all of this? Well, with ultrasound, again, utilizing ultrasound, this would of course only be possible with a face-to-face visit. So, and by doing these face-to-face visits, maybe sometimes your patients are like, "Hey, I really can't come see you 2, 3 times a week for, the next 4 or 5 weeks." If you're in that type of practice mindset, or maybe you're in the mindset of maybe one time a week for 6 weeks, doesn't matter. I'm not here to cross hairs about that, but rather, I've actually had patients for the last couple years. They'll come see me. I'll do a hands-on assessment. I'll maybe do some diagnostic ultrasound if it's warranted, and I'll say, hey, you know what? I really think that you're going to need a couple sessions that are strictly hands-on, a lot of manual therapy, but then maybe the next 5 or 10 sessions after that, we can kind of manage you remotely. You go to your own gym, you do your thing, and you'll be able to kind of manage these symptoms on the back end. And if anything kind of arises or gets complicated, you can give me a call. We can set up another face-to-face consult, whether it's just a manual therapy basis, or that we can kind of check with the ultrasound scan again and see where that's going. So that's one of the areas where I think that this ultrasound is going to play a role in the future. And even in my mind, I'm thinking about a scenario where patients, or maybe they are that snowbird like I was talking about, and those patients, they come from where I'm in Southern California, and maybe from there they go back home where it's Canada. A lot of my patients are Canadian. Maybe they go to Canada or Washington State or New York or what have you, and it would be nice to say, okay, well, here I did this ultrasound image. I'm going to put this up in your electronic chart. I know that you're going to go back to home, wherever home may be. I'm going to manage you. Maybe the patient likes you, and you as a clinician, you're going to manage their symptoms. You're going to manage their exercise programming. But hey, you know what? It's been a month and a half. It's been 2 months, and they want to have a checkup. They want to see how their tissues are doing, but they certainly don't want to, or it's not possible for them to fly down to see you. Okay, well, that's fine. And this is where the real benefit of having more clinicians certified and utilizing these services are going to be a benefit. Maybe you have a couple clinicians in your network and say, you know what, I know it's a 20-minute drive, but here I know Dr. John, and John is great with this. He's going to take some repeat images for you or for me. I'll pay him a little bit for that service. That way he's just there. He's kind of a fill-in body in place, and then we can kind of collaborate between. Maybe you decide that you like working with Dr. John better and you want to just stick your face-to-face there and come back and forth. But either way, I think by utilizing these services and getting more clinicians utilized with these services, we're going to be able to cross pollinate or cross collaborate between clinicians, between state lines, and do it effectively, much sooner or much more effectively than we will waiting for this licensure compact nonsense to go through. So if you have any questions or you have any ideas for the future, I'm always interested to see where this will go. And every other day, new ideas come to us, and when that time comes, I'll be happy to share with you. Thank you for watching.